My project was aiming at the development of a deep learning algorithm for the automated detection and classification of bone marrow cells in cytological preparations and bone marrow aspirate smears. The assessment of bone marrow aspirate smears is part of the routine diagnostic workup of patients with hematological disease, and it's usually combined with the histological examination of bone marrow biopsies. It is often the first step in the acute clinical setting of unclear cytopenia and suspicious leukemia. Bone marrow smears or imprints are the basis for performing manual differential cell counts of different cell types within the main hematopoietic lineages, and particularly important for the quantification of immature cells, so-called blasts, but also for the qualitative assessment of hematopoietic cells. The WHO and the International Council for Standardization in Hematology recommends to perform a manual 500 cell differential count if it's relevant. The manual differential count is quite labor intensive and time consuming and requires high expertise. So this is why we aimed at developing a model that counts hematopoietic cells, similar to cell counters that are used for differential cell counts in the peripheral blood. The practical approach was that we first selected 20 archived bone marrow aspirate smears from patients with normal or reactive findings in the bone marrow, and the slides were then digitalized, pseudonymized, and uploaded to the Aiforia Create platform. And then using Aiforia, we started with the training of the model, which was initially based on 16 cell types, which we later reduced to 9 major cell types. We consider that sufficient as a rapid screening test, including like blasts, promyelocyte, metamyelocytes, the 4 different types of granulocytes, lymphocytes, monocytes, plasma cells, pronormoblasts, and normoblasts. We did not exclude megakaryocytes and mast cells in our model because these are so few, and stroma cells are not part of the bone marrow differential cell count. After that, we performed single cell annotations in training regions to define the so-called ground truth, and repeated that until the model achieved adequate performance. Lastly, we performed an external human validation, which was done by 3 experts in bone marrow cytology. An important prerequisite for performing this project and for using AI was obviously digitalization. Digital pathology has become clinical routine in most laboratories, at least in Sweden, but digitalization of cytological slide preparation took much longer time. In fact, this was introduced in our laboratory for only 3 years ago. And then obviously digitalization of microscopic slides opens many possibilities for AI approaches, aiming at the potential implementation in the clinical diagnostic work. And second, AI is an ideal candidate when it comes to the automatization of certain steps, particular when it comes to quantification. The aim of the project was to create an automated tool that potentially could replace the manual differential count on bone marrow smears. But bone marrow differential count is highly complex and based on the recognition of at least 9 different cell types or classes with highly complex cytological features that even can vary within individual samples. There are commercially available blood cell counters, but those are not applicable to the bone marrow. Basically, therefore, this project would not have been possible at all without using convolutional neural networks. The biggest benefit of using the Aiforia Create platform is that it's cloud-based and that it did not require installation of any sophisticated equipment at our laboratory. The microscopic slides that were used for this project were digitalized and uploaded to the platform. And the only requirement was that the slides were stained with the same staining protocol and that the same scanner was used. Another advantage was that the training and external validation was completely remote and could be performed at any place and at any time. And this was clearly a big advantage. My experience with Aiforia is very positive. The Aiforia platform is user-friendly and has inbuilt support with a quick start guide to Aiforia, and also knowledge center with a lot of information on how to create an AI model. I started my project a couple of years ago and had continuous support by 2 Aiforia experts throughout the project, either by mail or during scheduled Zoom meetings. I need to admit, if I had done my homework from the beginning and prior to the training on the model, taking advantage of the really excellent information provided on the Aiforia platform, I would probably have saved a lot of time and been more efficient. But I work full-time clinically and did not have any dedicated continuous time period for the project. So that's why I probably relied very much on quick and immediate support, which I always received. I would definitely like to continue working with Aiforia on other projects within my field of expertise, which is clinical hematopathology. AI application in digital pathology is rapidly expanding and will more and more be integrated in clinical laboratories. So that's why I'm personally very much interested in continuing working in this area. And the potential applications are unlimited. I don't think that AI will replace me as a hematopathologist in the future, but it will definitely improve the workflow and the quality of our reports.